Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Half a day and welcome back to Healthy Living. If you're just tuning in, we are talking about perimenopause. And with me is Express Care's Dr. Yitka Lum, and she is very ready to tackle your questions. All right, Doc. So our first viewer is asking, when enduring perimenopause, are there any vitamins or supplements that I should be taking?
You can take a supplement. There are a few things out there that can help. Black cohosh is one that's very well known. Estrovan is another one. They basically are giving you extra estrogen. You can also take progesterone supplements. Progesterone is the mother hormone. From that one, actually there's cholesterol. From that you make progesterone. From that you make estrogen, testosterone, and all your other hormones. So if you go upstream and take a progesterone supplement, that can sometimes help you with your menopause or perimenopause symptoms. And the progesterone comes in a cream form. It also comes in suppositories or troches. These are things that you can, they're like lozenges. You can order those ones. And so that can really help women get through a difficult time.
All right. Now, how can, our next viewer is asking, how can I manage my hot flashes?
Yes. So back to exercise. That's the one that's going to help you the most. But you can take these supplements that we talked about for hot flashes, and then you could be on two other things. One is actual hormone pills. That would be birth control pill, like you mentioned earlier, or actually plain estrogen if your mammogram and your uterus are okay. And then there's a medicine called clonidine. It's used for high blood pressure, but it also works really, really well for hot flashes. And it's very cheap, and you don't have to take it all the time. You can just take it whenever you're having the problem, once every other day or occasionally when you're having a bad day. And it's very, very helpful. I like to use that one because there are no hormones involved.
Oh, okay. Now, our next viewer is asking, is it true that rhubarb extract can help with perimenopausal symptoms? Is this true?
It is true. It's a little bit helpful. So is flaxseed or flaxseed oil. These are supplements that may help you a little bit along the way, and everybody's different, and it won't hurt to try. I think I still have to emphasize exercise as the best remedy, though.
Okay. Our next viewer asks, during perimenopause, is it normal to gain weight?
It's very common. Again, there's a big change in the hormones. Remember, what is really happening here is that the ovaries, which were very faithful and true and produced a lot of hormone for many years, evenly all month long, are tired. And they're producing much less hormone now in the perimenopausal and then finally menopausal period. So supplementing them is a good way to go. Otherwise, just understanding you're going through a transition and you'll be okay at the other side.
Okay. Our last viewer is asking, how common is perimenopause? Does everybody go through it?
Well, everybody will go through perimenopause in their lifetime as women, but not everybody will have symptoms. Active women who are healthy typically will have very few symptoms, and we hope that for all of you out there.
Okay, I had one last question.
Sure.
What about women who have gone through getting their tubes tied or
Right.
their ovaries removed?
Mm-hmm.
Are they subject to the same symptoms as perimenopause?
And that's a really good question. Let's talk about the ovary question first. If for some reason a woman's ovaries are removed, let's say she had cysts or something like that, she will actually enter a premature menopause, meaning there's no hormones being produced by the ovaries, and that's definition is before the age of 40, either surgically or through some illness, her ovaries stop functioning. So she will go from being great to sudden menopause, and the symptoms are usually quite severe, and usually women really do need medicine. As far as the tubes being tied or tubal ligation, many women will actually experience changes in their periods after that's happened. Especially they may have had 3 or 4 children, then their tubes are tied, and after that they notice, wow, my periods are heavier, I have a lot more PMS, I don't feel the same as I did before. And this is true. Exactly how this happens isn't well known, but sometimes the blood supply to that area may be a little bit disrupted because of the surgery. There may be scar tissue that's caused problems there. No one really knows, but it is a common symptom, and it's something that women should be aware of before they make that decision.
All right, thank you so much, Doc,
Thank
for
you
your
very
knowledge
much.
and your
Thanks.
expertise.
Thank you.
All right, when Healthy Living returns, we'll be back to wrap up the show.
Your community calendar is brought to you by Taco Bell. Whether it's your first meal or your fourth meal, we've got you covered. Taco Bell. Live Más.